Research methodology for 10th semester students of the Faculty of Medicine. Research methodology is a crucial subject studied by medical students in their 10th semester. It aims to provide an in-depth understanding of the scientific research process, including planning, execution, data analysis, and preparation of research reports. This knowledge is essential for producing valid and reliable research that contributes to advancements in medical science and public health. 1. Definition of research methodology. Research methodology is the study of scientific methods for collecting, analyzing, and organizing data to answer research questions or solve problems. The main components of research methodology include selecting a research design, data collection techniques, data analysis, interpretation of results. Research methodology is designed to ensure that the research process is systematic, organized, and reproducible. 2. Stages of scientific research. 1. Identifying research problems. Researchers need to identify problems relevant to the field of medicine or public health. Problems must be specific, measurable, and impactful. Example: is there a relationship between smoking habits and the risk of hypertension in young adults? 2. Literature review. A literature review is conducted to understand previous research and identify gaps that remain unanswered. Sources: scientific journals, books, research reports. Purpose: to establish a theoretical foundation and conceptual framework for the research. 3. Formulating hypotheses and research objectives. Hypothesis: a tentative assumption to be tested in the research. Example: smoking increases the risk of hypertension in young adults. Research objectives: what the research aims to achieve. Example: to analyze the relationship between smoking habits and the risk of hypertension. 4. Selecting a research design. The research design is chosen based on the objectives and type of data needed. Types of research designs include: 1. Descriptive research describes phenomena or specific characteristics. Example: prevalence study of anemia in school children. 2. Analytical research analyzes the relationship between variables. Example: case control study on the relationship between fast food consumption and obesity. 3. Experimental research tests the effect of an intervention on a variable. Example: clinical trials of a new diabetes drug. 4. Qualitative research explores individuals' experiences or perceptions of a phenomenon. Example: interview studies on cancer patients' experiences with chemotherapy. 5. Data collection. Population and sample. The population is the target group of the research, while the sample is a subset of the population being studied. Sampling techniques include random sampling, stratified sampling, and purposive sampling. data collection instruments, questionnaires, interviews, observations, or clinical measurement tools like blood pressure monitors. Data validity and reliability. Data must be valid, measure what it is supposed to measure, and reliable, consistent if repeated. 6. Data analysis. Data analysis is performed to answer research objectives or test hypotheses. The method of analysis depends on the type of data. Quantitative data, statistical analysis such as t-tests, regression, or ANOVA. Qualitative data, thematic or narrative analysis. Statistical software such as SPSS, STATA, or R is commonly taught to aid data analysis. 7. Presentation of results. Research results are presented in tables, graphs, or narratives. Results must be objective and based on the data obtained. 8. Discussion. Compare research findings with previous studies. Explain the implications of the findings and the limitations of the study. 9. Conclusions and recommendations. Conclusions. Answer the research objectives based on the findings. Recommendations. Provide suggestions for future research or the application of findings in practice. 10. Report writing and publication. Research is usually compiled into a report or scientific article. Publication is done in scientific journals to disseminate research findings. 3. Key components in research methodology. Research variables. Independent variable, the factor that influences other variables. Example, smoking habits. Dependent variable, the factor being influenced. Example, risk of hypertension. Research ethics. Research must adhere to ethical principles, such as informed consent. Respondents are fully informed and give consent. Confidentiality. Personal data and identities of respondents must be protected. Non-maleficence. Ensure no harm comes to respondents. Data quality. Internal validity. The extent to which results reflect the actual causal relationship. External validity. The extent to which results can be generalized to other populations. 4. Common research topics in Semester 10. Clinical epidemiology. Prevalence studies of certain diseases in populations. Public health interventions. Studies on the effectiveness of health promotion programs. Clinical trials, testing new drugs or therapies. Environmental health, the impact of air pollution on public health. Mental health, the relationship between work stress and anxiety disorders. 5. Challenges and opportunities in research. Challenges, limited resources, constraints in time, funding, and access to the research population. Ethical challenges, securing consent, especially in sensitive research topics. Complex data analysis, requires sufficient statistical skills. Opportunities, digital technology, utilizing big data, survey apps, and automated data analysis. International collaboration. Cross-border research for global issues like pandemics. Increased funding. Many research grants are available from governments and organizations. Conclusion research methodology is a fundamental component of medical education that trains students to think scientifically, systematically, and critically. In the 10th semester, students not only learn theoretical concepts but also gain practical experience in designing, conducting, and presenting research. This knowledge equips them to contribute to the advancement of science and evidence-based decision-making in healthcare.